OpenAI's O3 Deep Research just solved 18 pediatric genetic cases that had remained unsolved for years. One patient, Kyra, spent 19 years seeking diagnosis from age 9 to 28 before the system helped identify her condition. This isn't a press release claim. This is published in NEJM AI, the New England Journal of Medicine's AI journal. That matters. Here's what happened. OpenAI and Boston Children's Hospital ran a study on 376 cases of undiagnosed pediatric genetic disease. These are real patients with real medical histories who had exhausted conventional diagnostic pathways. O3 Deep Research contributed to solving 18 of them. The study is peer-reviewed and published. The methodology is transparent. Why this matters right now? This is the first credible large-scale validation of a reasoning class AI model in medical diagnosis, not in a lab, not in a simulation. In actual clinical cases where the outcome is a patient knowing what's wrong with them after years of uncertainty. For AI builders and healthcare operators, this changes the conversation. Deep reasoning models aren't theoretical anymore. They're not benchmarks. They're producing diagnostic insights that human specialists either missed or lacked the computational bandwidth to surface. That's a different category of capability than what we've seen in prior medical AI work. But let's be precise about what this proves and what it doesn't. The study shows a 3D research assisted in diagnosis. It didn't replace physicians. The system worked within existing diagnostic frameworks. It didn't invent new medicine. And 18 cases out of 376 is meaningful, but not universal. This isn't a magic bullet, it's a signal that reasoning models can handle certain diagnostic problems at a scale and depth that humans can't easily replicate. The peer review and NEJM AI publication create a credibility layer that matters to hospital administrators and compliance teams. When your legal and regulatory teams see a paper in NEJM AI, the conversation shifts from, is this even safe, to, how do we validate and integrate this? That's the operational inflection point. Watch for hospital systems beginning to integrate reasoning models into their diagnostic workflows over the next 12 months. Watch for FDA guidance on AI-assisted diagnosis and whether it creates a clear pathway for clinical validation. And watch whether competing labs, Anthropic, Google, XAI, publish similar studies. That's how you know this isn't one-off marketing. That's how you know it's a real shift in what medical AI can do. If you're building systems that solve hard problems with limited data, this paper is essential reading. The methodology alone is worth your time. Join the community, link in the description. Build the system, automate the rest.